Good morning. Myself, Dr. GAURAV GOYAL, PG second year in Muzaffarnagar Medical College, Muzaffarnagar, is presenting a paper on Doppler assessment of fetal pulmonary artery as predictor in neonatal respiratory distress. Introduction and background. Respiratory distress is one of the most common reasons an infant is admitted to the neonatal intensive care unit. 15% of term infant and 29% of the late preterm infants admitted to the neonatal intensive care unit develop significant respiratory morbidity. This is even higher for infants born before 34 weeks gestation. Ultrasound is the non-invasive and essential technique for routine perinatal screening. Many trials have studied the relationship between fetal pulmonary artery Doppler waveform and the fetal pulmonary hypoplasia, and whether fetal main pulmonary artery Doppler indices can predict the development of neonatal respiratory distress syndrome, and concluded the development of neonatal respiratory distress can be predicted using the main pulmonary artery 80 by 80 with high sensitivity and specificity. Here 80 is the acceleration time, 80 is the ejection time. Doppler velocimetry provides a simple and non-invasive method to assess the fetal pulmonary circulation. Aims and objective to obtain fetal pulmonary artery Doppler indices in the pregnant patient included in the study, to correlate the fetal pulmonary artery Doppler indices with the appearance or absence of respiratory distress in neonates. Exclusion criteria: pregnant female less than 28 weeks of gestation age or more than 40 weeks, multiple gestation, uncertain gestational age, congenital malformed fetus. This study aimed to highlight the predictive role of perinatal fetal main pulmonary artery Doppler measurements in neonatal respiratory distress syndrome development. Need for the study: methods for assessing fetal lung maturity include both clinical and ancillary approaches. Clinical method involve tracking menstrual history and the last menstrual period to estimate gestational age, conducting abdominal examination to evaluate fetal growth, and noting the quickening date when the mother first felt fetal movements. Additionally, the image techniques such as radiography and ultrasonography were used. Radiography employed X-ray to visualize lung structure, while ultrasonography used sound waves for a non-invasive view of fetal development. Ancillary methods include amniocentesis, a procedure that extracted amniotic fluid from for analysis, providing valuable insights into the fetal lung maturity and other important factors. It carried significant risk, although with a low incidence, including premature rupture of membranes, preterm labor, placental abruption, fetal-maternal hemorrhage, and fetal injury. In rare instances, can lead to fetal death or even maternal death. Materials and methods. Study design is prospective observational study. A total of 67 patients were examined. 7 cases were excluded from the study. 3 patients gave birth more than 48 hours after the ultrasound examination. 2 cases had RD due to other causes than RDS. 2 cases were discarded for missed neonatal data, and 1 case is for suboptimal ultrasound data. Finally, 60 fetuses were eligible for analysis, among which 11 were diagnosed as RDS positive and 49 were RDS negative. Methods. The graph showing fetal main pulmonary artery showing a typical spike and dome pattern, and then 80 by 80 ratio calculated. Fetal MPA Doppler waveform produces a specific spike and dome pattern and a small notch at the end of systole, providing 80-80 ratio. The fetal main pulmonary artery was visualized by the slightly translating the transducer superiorly from the 4-chamber cardiac view to obtain the 3-vessel view. The pulse Doppler sample gate was placed at the middle of the fetal MPA between the pulmonary valves and the pulmonary artery bifurcation. After enlarging the image as much as possible, the sample gate was adjusted to 3 mm. Fetal MPA Doppler waveform produced a specific spike and dome pattern and a small notch at the end of systole. Observation. After the optimal fetal MPA waveform were obtained, relevant Doppler velocity variable were measured 3 times using manual trace, and measurement were averaged. The Doppler variable indices, acceleration time and ejection time were recorded. From these measurements, the 80 by 80 ratio was calculated. Diagnosis of neonatal RDS. Upon delivery, the route of delivery were recorded. Neonatal birth weight and Apgar score at 1 and 5 minutes were documented from the records. The diagnosis of RDS based on the clinical sign of respiratory distress, tachypnea, that is tachypnea, retraction, or nasal flaring, supplemental oxygen requirement of 0.4 or greater than at least 24 hours, typically chest X-ray. Findings were recorded from the NICU admission records. Analysis and the result: out of 16 units, 11 are RDS positive and 49 are RDS negative. Out of 11 RDS positive, 8 units, 8 mothers have average of 27.9 plus minus 8.4, and 3 mothers have an age of 26.5 plus minus 3.4. This is a graph showing 80-80 ratio in the RDS negative. Blue graph is showing the RDS negative and the red graph is showing the RDS positive. The mean 80-80 ratio in MPA Doppler velocimetry was significantly lower in fetuses than some subsequently developed RDS compared to those with RDS with a p-value of less than 0.001. This indicates that the 80-80 ratio was positively correlated with the RDS outcome. This is a chart description. Then case 1, 28-year female, G2 P1 37 weeks gestation female, PI value 2.42, RI value 0.8, 80 ratio 0.32. And case 2 is 23 female, G2 P1 38 weeks gestation female, PI value is 2.4, RI value 0.82, 80 ratio is 0.33. Case 3 is a 32 female, G1 P1 36 weeks gestation, PI value is 2.37, RI value is 0.81, ATET ratio is 0.31. The case 4 is 26 female, G1 P1 37 weeks of gestation, PI value 2.33, RI value 0.8, and ATET ratio is 0.27. Discussion: respiratory distress syndrome in newborn, also known as a hyaline membrane disease, is a serious condition affecting premature infants. It is linked to structural and functional lung immaturity and is one of the leading cause of neonatal mortality. Identifying fetuses at risk for RDS through accurate assessment of fetal lung maturity is crucial for determining the best time for pregnancy termination, particularly in high risk cases. We focus on parameters that were not significantly influenced by the angle of insulation, such as acceleration time to ejection time ratio, pulsatility index, resistivity index. There was a significant correlation between the ATET ratio and the development of RDS, with the ATET being notably lower in the RDS positive group and compared to the RDS negative group. In contrast, both PA and RI did not show significantly statistically significant difference between the two groups, with PI value of 0.31 and 24 respectively. Our study indicated the ATT ratio of the fetal pulmonary artery was a valuable indicator for predicting fetal lung maturity and the subsequent risk of RDS, demonstrating high sensitivity and specificity. To further validate these findings, larger prospective study were necessary to evaluate the effectiveness of ATT ratio in predicting fetal lung maturity. Additionally, it was important to explore whether this ratio could serve as a replacement for amniocentesis in assessing fetal lung maturity, potentially aiding in preventing neonatal RDS. Limitation: Doppler is readily available on many ultrasound machines and the result can be obtained immediately. However, it is rather difficult technique, heavily operator dependent, requires a great deal of experience. Therefore, there is a great deal of inter-observer variability, which is major drawback for such a sensitive and crucial test. Large prospective studies are needed to assess the sensitivity and specificity for ATET ratio to predict fetal lung maturity and to further assess whether the ATET ratio can replace amniocentesis for fetal lung maturity testing with a view to prevent neonatal RDS. These are my references. Thank you.